I'm Laura Kaiser, President and CEO, SSM Health. We are an $8 billion not-for-profit Catholic health ministry that's based in St. Louis, Missouri, with different hospitals, a health plan, pharmacy benefit management company, ambulatory care, et cetera, in 4 Midwestern states. SSM is a Catholic health ministry that's been around for about 150 years. And our focus began when the founding sisters appeared on the shores of the Mississippi River in St. Louis. And they came here to help people in need. And I imagine that they looked around and identified need in terms of how they could help people. And one of the things that they did is they took care of people when there was a smallpox epidemic. And actually, a number of them perished as a result. And so when I think about the parallels, not interested in having anyone perish, patients or caregivers, but this is an infectious disease and one that needs the right protective equipment and precautions taken. So it feels very congruent with who we are as a Catholic health ministry of taking care of people, all people that need us to do so. The way that SSM is responding and behaving in the pandemic is that we are a partner with everyone in the community. And so the way that we are showing up in the pandemic, I'll give a specific example in St. Louis, Missouri. We happen to be based in St. Louis, Missouri, but we're scattered throughout the Midwest. In St. Louis, the market is a pretty fragmented one. We have other health systems here, BJC, Mercy, and St. Luke's, and the VA is here as well. This pandemic has aggregated all of us into what has now been formed as the St. Louis Metropolitan Pandemic Task Force. And the work that we're doing together is truly extraordinary. I say that humbly because I'm only one of many members. The Chief Medical Officer for SSM Health is a physician named Alex Garza, who is serving as the incident command for the entire task force for the area. The health systems are locked arm in arm. We're working very collaboratively together. And Alex's background of serving in the Obama administration as the Chief Medical Officer for Homeland Security through the H1N1 pandemic, being a colonel in the Army for 20 years, is really, his gifts and talents have uniquely prepared him for this situation. And so it's been pretty beautiful. It's a beautiful thing to see how we all together are working so well to best serve our community. In partnership with the other providers in our respective markets, we went forward in a unified fashion to discontinue all elective and what I'll call deferred procedures, procedures that people need but were not life-threatening, and so they were deferred, some surgeries that people need, et cetera. We are all still collectively not doing any of those procedures. We've begun to have conversation about how do we think about reopening and recovering. We have to be careful about doing that. As long as we're talking about that in a patient safety perspective, it's great, but we have to be very careful so that it's not perceived as anything anti-competitive. And so we have guardrails around that. But the impact that that has had on, I think, every health system in the country is consistent with what has been our experience. Our volumes are decimated. And so you'd expect that to be because we were all preparing for the surge and trying to ensure that none of us were flooded with the capacity that exceeded our ability, or with the demand that exceeded our ability to handle the patients that needed us. So as I've been talking with different civic leaders and elected officials, et cetera, and just family and friends and neighbors, I've heard, because everybody's worried about the economy, I've heard more than once, but you guys are doing okay because you're taking care of all the patients, et cetera. And I've said, oh my goodness, we are absolutely not doing okay because we've had to shift appropriately, as I just described. And so we are really damaging ourselves financially, and it's worth it. Obviously, we would do this all over again. And I'm very grateful that we have a balance sheet that allows us to do that. But there are other smaller facilities and systems that are really in perilous waters, and the federal relief has been helpful, certainly with cash flow for some, but it's not replacement revenue. It's just helping with cash flow. And so I worry about the long-term viability of some of the smaller hospitals and health systems. And for us, I want to be sure that that's something that's well understood in these conversations as we talk about reopening, so that the civic leaders, the elected officials, don't misunderstand that we, for some reason, are not striking a good balance between patient safety and our medical capabilities and a return to the economy. We're equally interested in reopening the economy, but we are absolutely interested in doing so in a safe way. I think the pandemic is creating a different world. And so therefore, there will be a different type of healthcare system. There will be echoes of what has been, because in the American healthcare system, there are many things that are wonderful. There is also opportunity for improvement. And so we've seen just one tactical thing. We've seen a tremendous transition, which I think is a really healthy one, in telemedicine. Prior to the pandemic, we were set up and we were doing some telemedicine, and we were seeing an average of a couple hundred patients a day. So relatively low, especially I had come from Intermountain Healthcare that was more accelerated around telemedicine before coming to SSM 3 years ago. Since the pandemic, we have shifted from about 200 per day to almost 5,000 a day. More strategically, I think that we have the opportunity as a healthcare system to really, and I hope that we carve out the time to do so, because it is still very nonstop and a flurry of activity. But I hope that we will collectively carve out the time to be very thoughtful about what have we learned from this pandemic? What are the gaping holes in our system? How can we take advantage of this time to really think about what we should focus on? What should we discontinue and not pick back up if it's been something we put aside? Or how should we be thinking about priorities going forward? And one of those for me is I'd really like to see how we can spend more time and then do some very concrete things around preventive medicine and public health, and think about how are we better prepared for helping overall health status improve. It's the age-old social determinants of health. How can we as a health system speak with all of the different interested parties, the federal government, the state governments, the health systems, the health payers, all of us, about shifting and becoming more aligned around total wellness versus just acute rescue care. I think we have a lot more to learn, and this pandemic, for me anyway, has revealed, I think it was President Obama that said this, sometimes crises have a way of revealing what we already knew, and that there is disparity in healthcare, and there is opportunity for improvement in our health system in total. And we're all talking about social determinants of health and the impact that that has on people's overall well-being. That's still true, and we have work to do.